So we have 3 large cement plants within the UK. A kiln shutdown happens every year, generally in January or February time, across 3 plants. The main obstacle this year was we had to have the same levels of safety requirements, but with COVID as well.
Well, it was challenging due to the number of contractors.
1,500 people or contractors across the 3 cement plants into a small little environment from every corner of the UK. We had many levels of COVID control around site. The first thing was we set up a COVID testing centre, which included the lateral flow tests, and those were provided for every single person who entered site.
4 nurses attending from IDC. The negative test will allow them to come and work on site for a week. They were given a certificate from the nurse and a lanyard to use it as identification for the test. They were also given a sticker, a different color every week, similar to ones I have there, for easy visual identification on site.
During the testing process we identified several cases of potential COVID. That person was isolated and with instructions to leave site and to undertake a further test. We also then implemented a daily check which involved temperature checks and ensuring people had no COVID symptoms. We implemented social bubbles or working bubbles, which ensured that people from a same family or same travelling arrangements was working together in their own safety bubble. Social distancing was always our primary control with all individuals on site. We did have certain circumstances where that 2-metre rule could not be achieved, so every single person had to wear a medical mask, and this was our number 1 form of PPE. So each contractor generally bring their own welfare facilities onto site, but this year we had to increase the amount of welfare facilities.
For safety reasons, they all had to be segregated, so each company had its own dedicated welfare facilities, rest areas, shower blocks, toilets, and they were the only company allowed to use them facility.
We was always conscious that maintaining the standard was fundamental, so we set up an electronic phone app which allowed us to complete live inspections and audits on a day-to-day, and these was analysed at the start of every morning to identify any areas of improvement. Everybody felt that there was being the levels of safety and COVID was being maintained. People was reassured that we weren't contributing to the spread of COVID. The actual comments were that they feel safer at work than they do at home. We got through 3 major shutdowns without any single case of COVID transmission, and that was down to all individuals, contractors, visitors and Hanson personnel taking an active role.